2025 regular meeting of the Burlington Board of Health to order. Please join me for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Well, good evening, everybody.
Good evening.
I'm Dr. Ed Weinert, and I'm chairman. And with me this evening are Board of Health members, Andrew Sheehan and Gail Gamori, who is our vice chair. And our professionals this evening, Susan Luminella, who is the Director of Public Health. Michael Green next to her is our Associate Director of Public Health. Environmental engineer is Christine Mathis. Marlene Johnson is our health agent, and our recording secretary, Julie Falkingham. I guess she's online. Is she online?
Yes.
Hi, Julie. I want to thank the Burlington Buzz, our Burlington Daily newsletter, for covering our meetings. A number of people, as I've said in the past, have noted and have commented on her updates, and thank you so much. And as always, please note that we are live on and being taped by BCAT and available for our appropriate comments and questions through this video technology. And as always, thank you for BCAT for what you do for this community, keeping us all aware and so well informed. First, our approval of minutes, and we have two. The first is 12/10/2024, and maybe our director would like to comment before we act on them, what we found from town council.
Yes, so Julie, actually, she reached out to town council, and she made edits to the minutes. Julie, do you want to describe what those edits were? So.
Hi,
oh,
yeah. Sorry, sure, yes. So it looks like something along the lines of a permit. I do need to take everyone's vote.
Yeah, so the question was from town council, do we need to have, list everyone's name and what they voted? So the response from town council was, yes, you do, if it's something that is like permits or variances, not so much minutes, if it's something that, for minutes you don't have to do it, but you do have to do it for other things on the agenda. So that's what came back from town council, so based on that, Julie edited the minutes, because that was your question on the minutes, right?
Mm-hmm. I think everybody wanted to know. So if it's 500, you don't need to list it, because we know who's here. But if it's 401 or 41, then you have to list who voted what.
Right,
Which
unless it's
Depending on what it is.
approval of the minutes.
Minutes.
And then,
Okay. Thank you, Julie. So I have the approval of the minutes for December 10th as edited. Do I have a motion?
So moved.
I have a motion from Ms. Demori, second by Ms. Sheehan. All in favor? Aye. 300. And now we have one for January 28th, 2025. I don't think those were edited.
No.
So could I have a motion?
Motion to approve.
I have a motion to approve from Ms. Sheehan, second by
Second.
Ms. Demori. All in favor? Aye. 300. Now, citizens' time. Are you here for a specific agenda item? Yes. Is there anybody online who would like to speak to this board?
No one for citizens' time.
Nobody from citizens' time, so we can move on. Which brings me to Chairman's report, and as always, I have something. Over the last months, I've given a couple of public presentations and have talked to many people within the town. And I get a lot of questions, and I'm sure you both also do, about the basic operations and the makeup of this Board of Health. I thought I'd share some of those questions over the next few meetings. So let's play a little Board of Health Jeopardy. First, easy one. How many elected Board of Health members in our town? Well, we all know there's 5, with staggered terms, 3 years, and that includes the vice chair and the chair who are voted on by the sitting members. Now, a lot harder. How many Board of Health professionals do we have both historically and today? Well, when I got on the board in 1989, I believe there were 4, 3 full-time and 1 part-time. That's all we had. And today, with more responsibilities, more laws, many new requirements, a lot of food establishments, industries, and many scientific and biotechnology institutions, and our grants, health promotion programming, and an undergraduate intern, a university that we've had here for many years, and now a new medical school, Leahy Clinic. And how can I forget the very large Medical Reserve Corps, and I could go on, that we now have 6 professionals and 2 administrative personnel. So we've grown, we've doubled over the last 36 years. So more in grants, more on the ball of Burlington Medical Reserve Corps, and specifically what we do. I'll be talking about that in the coming weeks for those of you who tune in. And as I like to say, and I have said for a long time, this isn't your grandfather's Board of Health. So let's move on with the agenda. There are no subcommittee reports this evening, and we will go to Rowan Incorporated, 75 Middlesex Turnpike, space 107 for Article 5, Section 1.1 of the Burlington Board of Health Rules and Regulations for body art establishments and practitioners. So who would like to present that?
Yes, I will.
Director.
So it looks like we have 2 people online from Rowan. They are requesting a variance from the body art regulations to do piercing of the other parts of the ear, not the earlobe. So the earlobe is exempt from our regulation, but the top parts of the ear are not. And actually, the variance request is for our regulations require that practitioners have 2 years of experience. So they would like to have nurses instead of having someone with 2 years of experience. And they can talk a little bit more about their materials. That there's a lot of things that are attached in your board book, and that's everything that they provided to us about their training and their policies and how they run their business, basically. If the variance is granted, each practitioner has to get their own permit from the Board of Health, so they'd have to come to us, fill out the information, and we'd check their licenses, make sure they are nurses before we give them a permit. So I don't know who from Rowan wants to speak.
That'll be me. Thank you so much. Hi, thank you so much for having us today. My name is Danny Axelrod. I am the Vice President of Operations for Rowan. Rowan is a retail company that offers ear piercing performed exclusively by licensed nurses. Only licensed nurses can perform piercings in our stores. We currently have over 65 locations nationwide, and we've been opening and operating locations since 2020. Rowan is also the only piercing company that is overseen and backed by a full medical board. As just mentioned, we are seeking a variance for our nurses to be exempt from this 2-year training requirement. Our philosophy is that nurses do go to school for much longer than 2 years and do go through a full curriculum and training program through Rowan. We have precedent also set through other cities in Massachusetts, in Dedham and Somerville, as it relates to this same 2-year training requirement, where we've been granted this exemption as well. I'd also like to note that Rowan only pierces ears and no other body part. So again, that is, our philosophy that, and our medical board's opinion as well, that, between our training curriculum and the fact that nurses do go to school for much longer than this 2-year training requirement, that they, should be exempt from this training requirement. And as noted, would all be, their licensure would all be checked and ensured that it was all up to date, and licensed individually before, being able to pierce in our location.
So, does anybody on the board have questions? I've got quite a few. Do you have any?
I have a couple, but two of them were already in. I think it makes sense now, so I think I'm okay.
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 All right. I have a number of questions before I ask.
Sure.
This is only ears, correct?
Correct.
And that will
Only
be a
ears.
condition of only ears. And
Yes.
you said nurses. Are these LPNs or are these RNs?
We hire both RNs and LPNs.
And licensed in the United States?
Yes, in the United States.
So if you had somebody who came from Canada or Mexico, or somebody in Europe who was licensed, one of our conditions would be within the United States?
Correct. We only hire nurses that have a active nursing license within the United States. That is a requirement for Rowan.
Now, I might have missed this, but do you have an infection plan if somebody comes back?
We do.
Okay, what is
Yes.
that? Would you just go through that, please? If somebody pierces the
sorry,
top
go
of
ahead.
the ear and then comes back 4 days for an infection, what do you do?
We have two different routes for them. We have a nurse hotline, so if they wanted to consult that without coming into the store, they can call that number at any time and they can consult with the nurse. They could send in photos or FaceTime with the nurse, and the nurse can consult with them that way, or they can come in and be seen by the nurse. The nurse will, take a look at their ear, advise, if there's something that the nurse can do on site to help clean, or, advise on what to do. Nurses cannot, prescribe medication or anything like that, but they would, advise if they did need to seek additional medical treatment. But that is something that we pride ourselves on being able to do, of being able to advise and, review the infections, where if you did go to somewhere else, it would not necessarily be a medical professional that would be able to, take a look at the infection.
So do you refer them to anybody?
Yeah, like every location we have an emergency action plan where we we identify the local places that we would refer either if it's an employee or a customer to. So each location has those identified locations prior to opening.
And my last question is, are you insured?
Yes, of course.
Okay. Does anybody else have any questions? 'Cause I would like to add some conditions to this.
Yes, I'd like to go over the conditions if, so in your materials, we stated 4 conditions. So the first one being, so this variance is body art practitioners operating in the location noted above. So it's only for this particular location in the mall. So if they open it up a different location, they'd have to come back for another variance. 2, all body art practitioner operating under this must obtain a body art practitioner permit, which we issue to them. They must maintain a current, now in here we have Massachusetts license, so it's not just Massachusetts license, so you take licenses from other states, is that correct?
We do take licenses from other states, but each location, the nurses need to be licensed in the state where they are working.
Okay.
So all of the nurses that will be working in this location need to be licensed in Massachusetts.
Okay, so we'll keep that in, so they must maintain a current Massachusetts license, because that's all they're gonna, is that okay? We're gonna keep that in as a condition?
Yeah, that's fine.
Number 3, variance is only for body art practitioners piercing and changing jewelry for the outer ear, helix, mid-helix, forward helix, black conch, and tragus piercings. 4,
Yep.
violations may result in appearance before the Board of Health and revocation
Yep.
of the permit. So those are the 4
Yes.
conditions that we put in there, so if you, I just wanted to make
Yes.
that clear before you discuss any new ones.
Yeah, I have 2 others that I'd like to add to that. that you have to have a written referral policy for infection, so who to refer to. So I'd like you to put
Okay.
that together. And the last is, I want to make sure that you have insurance, so you need to show that you do have an insurance policy for
Sure.
piercing.
Must submit proof of insurance.
Proof of insurance. So one is a medical referral policy.
Okay, no problem.
Must have a written medical referral
Policy.
policy, and must submit proof of insurance to the Board of Health.
Yes, those are the ones
Okay.
that I have.
So are you able to provide us with a copy of that medical referral policy?
Yes, we can pull that and get that to you in the next day.
Yeah, I mean, maybe you should change it to an infection, a plan for medical infection or something of that. Medical infection plan and referral policy.
Yep,
So if somebody comes in and they need to refer them, that we have provided, they have something that they can give these people and refer them to.
yes. Yes, I understand.
Do any of other professionals, our health agent or our environmental engineer, anything else? Any of our,
No,
then would someone make a motion?
I'll make a motion to approve the variance for Rowan Body Piercing Studio at the mall. I don't know what to call it.
With the conditions, yeah.
With the conditions.
With the
stated.
conditions.
So there's 6 total.
And do I have a second?
Second.
I have a second. All in favor?
Aye.
That's 300. You're all set. Please
Okay,
provide the information.
thank you so much for your time.
Please provide the
We will.
information before we, okay?
Go for it.
Yes.
Before you open. Thank you very much.
Okay, yeah, of course, absolutely. Thank you.
Good. Okay, now we have, under, no hearings, but under discussion, risk control plan to Tima Maxell's Jack's Coal-Fired Pizza, 2 Wall Street. Did I pronounce that well? I didn't pronounce that.
Tessa McCall.
What is it?
Tessa McCall.
Tessa McCall. Is that correct?
Mascot, yeah, I still have a hard time.
Tabasco.
As McCall.
Okay. So,
Do you want them to come up?
we want you to come up, two of you come up. And please print your names.
Excuse me?
Please print your name. And your position, please. We have our recording secretaries online this evening.
While they're doing that, the representatives from Tomasco's Jack's Coal-Fired Pizza are before you tonight due to 2 consecutive repeat violations. Take a look at the risk control plan that was attached. And Samantha Hardy and myself, we met with the general manager, Frank, who's here tonight, and we worked with him to make a risk control plan to prevent further violations. I'm sure you reviewed the risk control plan. It has to do with the high temperature dishwasher not providing the correct temperature during inspections. So it is the Board of Health policy that when we go out and we do an inspection, if there's a violation, we cite it, it's corrected, we go back. If it's another violation, then that's considered a repeat, that's the first repeat violation. The inspector talks to the management about that, and then if we go back again, and there's another repeat violation, that's when we have them come to the office and we work on a risk control plan. And we do this, and we have them come before the board. We do this because that way, if we have to bring them before the board in the future for a revocation of the food permit, this is why. So that way, there aren't any surprises. And so the representatives have been requested to appear before the board to discuss and inform the Board of Health of their risk control plan and how active managerial control will be achieved. And again, the board, there's no action required at this time. According to the Board of Health protocol, if in the future the health inspector determines that this food establishment fails to implement the risk control plan, then a hearing before the Board of Health will be scheduled where the board may vote to suspend or revoke their their food permit in accordance with 105 CMR 590.014, Section B, or revoke or not renew the food permit in accordance with 105 CMR 590.014, Part C.
Your name, please?
Frank Fitzgerald.
Frank, and you are?
Amy Magner.
Amy, what last name?
Magner.
Magner. Thank you. And you are, sir?
Sean McDonald.
Please, have a seat. Come on up. Would you like to?
Thank you.
You're not the first one who's come before us like this for the same type of situation. We pride ourselves with over 200 food establishments in this community, and with this is an international community with, as you heard, universities, medical school, scientific organizations, and that we pride ourselves, you can eat anywhere. And so you've provided, you put together a plan, and the question is, if you're not there, what happens? It's not, if you're not there and somebody sees that the temperature isn't up on the dishwasher, what do they do?
Well, so now we have a couple of different avenues of what our action is. I mean, specifically to that, if the temperature of the dishwasher isn't reaching the set point of 160, our next step is to hook up a low temperature sanitizer. Depending on the machine, how hot it's getting. So we'll test it once we hook up the low temperature sanitizer. If that doesn't work for the low temperature sanitizer, then our plan now is to go to the old-fashioned way of the 3-compartment sink. We call the Suburban is our dishwasher technicians, and they would come out and look at the machine. But ultimately, our fail-safe is the 3-compartment sink.
And the person in charge, if you're not there, and you can't be there all the time.
Exactly, yeah.
Knows exactly what the protocol is.
They do now, yeah. So what happened, the back of the house was kind of the back of the house, and the front of the house was more the front of the house. We've taken it all, so everybody knows everything that's happening with the dishwasher now. The back of the house guys, the chefs know, and the front of the house knows. The chefs are the primary people who are testing the machine, making sure it's running, but every day, the front of the house manager is going back and making sure that they tested the machine's running, and that we're ready for service for the day.
Anybody else have questions?
I just wanted to know that backup process. What does that 3-sink mean? Does that mean you're manually washing the dishes?
Exactly, yeah. So there's the wash sink, the rinse sink, and then the sanitizer sink. So it's set up, and it's there. We don't generally use it. They use it for heavy pots and pans. But if we had to, God willing, we wouldn't have to go to that. But that is the plan.
So your test, you test the water in the morning before the day activity? Like, is there a spot check during your hours of operation that guarantee that that's running at a safety level so that that silverware is clean for people to use?
Yeah, so what we do is it's one of the first things in the morning that the guys who open the restaurant, they're coming in and setting up the dishwasher. The chef comes, and he will test it, make sure everything's running. The manager comes behind him, says, okay, everything's good. And then we monitor as the shift goes on at the night. Partially through the dinner shift, we'll throw the disc in there just to make sure it's still going. And we kind of look at the gauges on the machine just to make sure. It gives you a general idea of the gauges will tell you now where they are. They're well past the temperature, and you can tell. When I see that it's well past, I say, okay, I feel comfortable. If it ever got to the point where it's kind of in the middle, we're definitely going to make sure we test it again to make sure that there's no concern with the thermometer again. and then take any necessary actions at that point. I feel really comfortable, though, now with the machine. This being our third time, I've been here for 2 of them at the location, and really went through it thoroughly with the suburban technicians on, what's happening, what do we need to do to get this machine up and running, just all the different. It wasn't as simple as I had once thought of, like, oh, the hot water comes in and it's good. It comes into one part of the machine, and then it kind of flows into another part of the machine, and then it flows into a third part of the machine. So myself, and I feel like the rest of my staff has a really good understanding of how the machine works and what we need to do if anything were to come up. But since the inspection and the techs came out and looked at the machine and kind of educated us a lot on, how it operates, I'm very confident now that the whole team there, we've done retraining with the chefs and the managers about the whole procedure with everything, and I feel really confident now at this point that the machine is running well, and we're monitoring it to make sure that it continues to run well.
How old is the machine?
The machine's approximately 8 years old.
Would you know what the average lifespan of that type of dishwasher is?
I don't know the lifespan necessarily.
I can,
You may know more to it.
a 15-year-old machine is more reliable than a brand-new machine. They're really a steel box. There's 3 or 4 components that get changed: pumps, elements, heating elements, and rinse nozzles. So, in general, this is like your dishwasher at home. The one you had 15 years ago works better than the LG electronic one you buy now. So the machine itself is in great shape.
Yeah. I'm sorry.
Ms. McDonald, what do you do?
Director of Operations for the Rebel Restaurants.
Okay, and Ms. Magna?
I'm a regional manager.
A regional manager. You got the whole group.
Yeah.
And then, just to answer your question, your first question, Frank went into the details right away, but we have 5 managers on. We have 5 managers locations, sometimes 6 salaried managers in that location. Each one of them is certified in health sanitation. If Frank's not there, any one of the other managers will be in his place. Each one of them knows, the operations of the machines. And since, our last, inspection, Frank's trained everybody in the dish area, anyone on staff, and they all know exactly how the machine works right now. We're, maybe we had some new hires that weren't properly setting the machine up in the morning. And we do have the logs, and the logs are being, used, so we won't have this problem going forward.
Okay. Ms. Johnson, are you satisfied with this?
I am. We wanted active managerial control, and we've got it now.
Okay, that's it. She's wonderful. She's been with us 20 years.
Almost, yeah, this December.
But she can be pretty tough. She can scare me. So I would not be lax on this issue, because she knows what she's doing. She's been trained and trains nationally now. You train people all over the country. So.
No, I think it's been a great learning experience with her to just further the knowledge for all of us to really, it's supposed to do something, but to know how it does it and everything.
Because it gets by her, goes to these people. Watch out. I have no other questions. Do anybody else? Ms. Johnson, do we do anything or just
That's it.
wish them well?
The discussion.
All right. Happy New Year.
Thank you very much.
Thank you. Thank you for your time.
Thank you very much.
All right. Which now brings us to temporary food permit. Marlene's going to do a wonderful presentation. I asked her to do this a number of weeks ago because we're getting so many temporary food permits in this town, and I think it's a good idea. We know what's going on in terms of food and with all of the organizations, and I think that's a good thing, because there have been some pretty bad things that have happened nationally in the past, where communities didn't have temporary food permits, and I did ask Marlene if she would please do a presentation, so we all knew exactly what's happening. So thank you so much.
Sure. You can go to the next slide. So some examples of temporary food events. We have farmers markets, such as Wayside Commons, fairs and carnivals, such as DPW Truck Day, PTO carnivals, classic car shows, Trucktober with the mobile food trucks, celebrations, such as Celebrate Burlington, the 4th of July, Diwali, fundraisers, the Burlington Public Schools, the PTOs have a lot of fundraisers, and restaurant food shows, Taste of Burlington, Chowder Fest, and food vendor shows. We used to have a gluten-free expo that used to come to Burlington. They had stopped after COVID, but they were here for a couple of years anyway, and that was a big event at one of the local hotels. Next slide. Temporary food permits. So there are two. There's the temporary food event organizer. So there's two organizer permits. So there's a temporary food permit, temporary food event organizer. That would be somebody who has more than 3 food vendors that they oversee. And then we have the seasonal food event organizer. And that would be somebody who is operating for longer than a month. So the seasonal food event organizer would be the Wayside Commons, because they operate once a month for 3 months. And then the temporary food event organizer would be, for example, the Taste of Burlington or Diwali. So the organizer responsibilities are, they have to complete an application, submit a fee, provide a list of food vendors, ensure that the food vendors apply for their own temporary food permit by our deadline. They are required to be on site during the food events, and they need to have knowledge of basic food safety. And we do provide basic food safety if the person needs that. And they are required to conduct their own inspections during the event to ensure food safety. So generally, the inspector will go out and do an inspection, but we're not there for the entire length of the event. So that's where the organizer comes into play. They are responsible, so they have to oversee the event for that whole time period. Next slide. So then we get into the temporary food vendor permit application. So these are the individual food vendors. So on their application, they have to list proposed foods, how those proposed foods will be transported, how they'll be held hot or held cold, how they're going to be cooked. They're going to be cooked at the event and served, who the person in charge is. They have to describe the location of the hand washing station. Sometimes the location will provide 1 or 2 that everybody can use, or sometimes the vendor is expected to provide their own within their own space. They would provide copies of Certified Food Protection Manager and allergen awareness training certificates. And if a food service establishment is outside of Burlington, we do require a valid food permit be submitted to us from that local Board of Health. The inspector may call the applicant to discuss the application if necessary. Sometimes we might see some food that we might want to ask some questions about. You know, they're going to be bringing turkeys. We're going to say, how are you cooking them? Where are you storing them? Are you cooling them? So we talk a lot of food safety questions. And after review, the inspector approves and issues the temporary food permit. Slide. No temporary food permit is required for potluck event. So a potluck event doesn't have to apply as long as these 4 conditions are present. People are gathered to share food at an event. There is no compensation provided to people for bringing food to an event. The event is not conducted for commercial purposes, and the participants at the event shall be informed that neither the food nor the facilities have been inspected by the state or a local public health department. This is a Massachusetts general law, and that became effective in November of 2014. These are things like religious or worship churches, things like that, that have a lot of the potluck events. Maybe some individual organizations might have a potluck, scouts might have a potluck event. Next slide. No temporary food permit required for bake sales. The Board of Health provides the following recommendations, however. Only non-temperature controlled for safety baked goods can be provided, so nothing that requires refrigeration, such as cheesecake or anything containing any kind of meat. They should provide an ingredient list for those who may have food allergies, and individually wrap or cover baked goods to protect from customer or environmental contamination. And do not handle unwrapped baked goods with bare hands. Use utensils, napkins, or disposable gloves. And next slide. And no temporary food permit is required for a mobile food vendor because they already have a permit. They have a mobile food permit, so that allows them to prepare and serve food in Burlington. Food that's picked up at a food service establishment and dropped off by a food service establishment, or with a valid food permit. So that would just be, you're going and you're picking up some food that you ordered and you're bringing it to your home, or perhaps the food establishment is delivering it to you and then they leave. Commercially prepackaged, non-temperature controlled for safety foods, so if those are given out, a permit is not needed for that, such as bottled water or soda, things like that. And during a parade, you wouldn't need a permit for that. And next slide, questions?
Any questions? I do. You mentioned the Taste of Burlington, which is a tremendous, outstanding event. I enjoy it every year. Who would get the temporary food permit? Would that be the Marriott, or would that be the Chamber of Commerce?
So it would be the Chamber of Commerce because they are the ones that are the organizer. And
Okay.
then each individual restaurant participant would fill out a vendor application and have a separate.
Because each one of them are already certified.
Right, and they would still need a temporary food permit because they're now outside of their restaurant preparing food.
And I just want to make sure that everybody out there understands who may be watching, is that religious organizations who have a dinner, a potluck dinner or whatever, are exempt from this, as well as some of the nonprofits would be exempt from
Correct,
this.
as long as they, those 4 conditions are met.
Amen. Thank you. Anybody
That's the
else?
same with like a bake sale at a basketball game?
Correct, as long as the food is non-temperature controlled for safety.
Okay.
Outstanding. Thank you. Any other comments? Again, outstanding. Thank you so much for doing this. I asked you to do this, to educate, teach us about this, and thank you so much. Staff reports. You're back up. The health agent, which will include the associate health inspector's report. Is there anything you'd like to highlight?
Well, the only thing I'd want to mention, I'm sure Susan and Michael mentioned too, that we went live with Tyler Tech, Environmental Health, the software. So I've been using that, doing inspections since Monday. And as expected, there's a little quirks here and there.
Learning curve.
Ironed out, but that's to be expected. But overall, it's really a nice system. So look forward to getting to become an expert in that. Are there any questions on my report?
The associate health inspector will be out for 6 weeks on medical leave. Are you're all set? You're planning?
Yes, we moved a lot of the inspections around, so we did some in
Outstanding.
advance, and then we're pushing some to the next when she comes back, and then I've been picking up a few. It's quiet during the winter, so it's easy to do extra inspections.
I have no questions. Do I have a motion to approve the health agent and the associate health inspector's report?
So moved.
I have a motion by Gail Demore, second by Andrea Sheehan. All in favor?
Aye.
Okay.
Great.
The next is environmental engineer.
Good evening.
Ms. Mathis.
So I just wanted to highlight that the dates for the household hazardous waste events for this year are set. They're May 17th and September 13th, and they're on our website, including information about what's acceptable, what's not, what to do with things that you can't bring, et cetera. And I have been inputting the biosafety permits, because they're all in renewal phase right now, into the new Tyler Tech program, and that's been good. It's pretty cool.
Any questions? I have one. Haiku, who was here last meeting, did they make the changes in the biosafety manual?
They did, and they have their permit.
Thank you so much.
Sure.
If nothing else, could I have a motion, please, to approve the environmental engineers report?
Motion to approve.
Motion by Ms. Sheehan, second by Gail Demore. All in favor? Aye. Brings us now to the Associate Director of Public Health. Do you have anything to present to us?
Nothing from my report, Chairman, but I do want to let you know on March 26th, we will have the annual BBRC meeting coming up that evening. So a little ahead of the curve, but that message will go out. So we will have our election. We've got 2 open spots on the executive committee.
Okay. You're doing matter of balance programming coming up?
We will. That's going to be coming up in, I believe, April 3rd is the first class that we're offering. It's going to be 2 times a week instead of once a week, so it'll only be a month long. So it's going to be Monday and Wednesdays through April.
Excellent. Do we have a program for the March 26th BBRC yet?
Drafting it up now.
Some speaker or something, a speaker?
Yes, we do have a speaker for that. We've got actually Narcan training.
Oh, well,
Coming in for Narcan training. We also have our community resource specialist with shared services. I think she's going to be assisting with that training.
will she be bringing Narcan to distribute?
The other trainers will be.
So they will have to distribute?
Correct.
Okay, good. I think that's important. Any other questions? If not, can we approve the Associate Director of Public Health report?
Approved. Second.
I have a motion by Gail Demore, second by Andrew Sheehan. All in favor?
Aye.
Okay. Which brings me now to the Director of Public Health. Susan, what would you like to?
Yeah, so just on Sandy's report, you mentioned matter of balance. So she has undergone some training where she can now become a matter of balance trainer. So she did like a train the trainer type of thing. So she can, we used to go through Leahy, Deb Sullivan at Leahy, and she's retiring. So Sandy took a pretty extensive course. It was like a week-long course to become trained in how to run a matter of balance class. So she will be overseeing all of our matter of balance classes instead of Deb Sullivan, because now she's a trainer. And she can also train our volunteers to be coaches at matter of balance. So this is, she's going to continue that. She'll be doing this one in the spring, and then hopefully she'll be training some more volunteers and then holding more courses, and then hopefully working with the shared services staff so they can bring the program to Lexington and Wilmington as well. She doesn't need to be at the program. She just needs to make sure that they're doing everything the way they're supposed to be doing it. Let's see, what else on my report? Oh, the Tyler Tech, as Marlene mentioned, the whole staff now is really kind of working on that. It's going to take us a little while to get all the information input into the system. We have all the food establishments in there because they were transferred over, but everything else we need to put all that information in, so we're working on that. And the health fair is, we're looking for exhibitors for the health fair. So we just put that PSA out. We're taking applications now. We have quite a few applications. I just want to remind the public and people who are considering to be an exhibitor that it needs to be health-related information for the public and not something for sale and you need to have some experience in the area where you're presenting, so.
And the date for that?
That's going to be April 26th at the Burlington High School.
Good. Okay, questions? Well, I've got a few. First, thank you. You were on a panel of public health for UMass.
Yes, that went very well. There was, actually, it was a panel of 6, so there was quite a few there. There was some substance abuse counselors, a couple of the public health directors. Yeah, so it went well.
Was there an outstanding graduate student to help put that together?
No, she just gave my name.
Your daughter is
Gave her
a
name
doctoral
to a colleague,
candidate at UMass
so.
at all.
Oh, okay.
And you did some community preparedness presentations. Did you do that?
No, so that's something that Juliana, our
Okay,
community
Juliana's
outreach
doing-
worker, is working on. She put it together, and hopefully she's going, Mike has gotten a grant from NACCHO. He applied for one. If everything goes through, we're going to be able to get some community preparedness kits. So Juliana is going to give this presentation to the public, and we'll have the kits available. If we don't get the grant, we don't have the kits, we'll just still have the presentation, but without the kits. So she's working on that. Mike and I have kind of sat down with her and gone over her presentation a couple of times.
Now, for Triton, there are a couple of vacancies.
Yeah, so we have interviews coming up for a public health nurse and for the health communication specialist.
Okay, thank you. And also, you represent tonight the supervisory nurse. Are there any questions on?
No, I liked her display.
Yeah.
Oh, yeah, she's
Good at it.
getting more people up.
Yeah, she's good at it.
Yeah.
And so how is the state student vaccine program coming?
She's doing really well on that, so she's getting them in, we're continuing to receive the students' names from the schools that need vaccinations. She's making the appointments and getting them all vaccinated. School nurses are real happy with that. She still gets them on a steady basis, so she still was working on that.
So just like the health agent and the associate health inspector, you're answering questions for those two?
Yeah.
Nobody had questions for the associate health inspector, I'm assuming. Okay, so do I have a motion to approve the Director of Public Health report?
Motion to approve.
Second.
All in favor?
Aye.
That's 300. I guess that's the end. Please, everybody, please be safe. Drive safe in the snow. It's going to be slippery the next few days, it appears, and the snowstorm may be this weekend. Be very careful. Be careful of your snow blowers. I just keep hearing issues where people have done some crazy things by putting their hands in a running snow blower. Please be safe. If you're not sure you can shovel snow, please get somebody younger who can shovel the snow. So it's still winter here, and with that, I'll say be safe and good night. Anybody else?
Motion to close the meeting.
I have a motion to.
Second.
I have a motion by Mr. Morris, second by Ms. Sheehan. All in favor? Aye. 300. Good night, everybody.